Good afternoon. My name is Brian Walkowski, and I'll be presenting this study, which is a survey of both the public and provider perceptions of robotic surgery. I have no ethical or financial disclosures. So the objective of this study, the aim was to determine the public's perception of robotic-assisted surgery as it pertains to clinical outcomes, provider technical ability, and marketability within a community, and finally, the role of robotic surgery within the future. These perceptions that were held by the public were then compared to those held by providers to help identify misperceptions and opportunities for education. So a little bit of background information, certainly nothing new here, but the Da Vinci robotic platform first gained FDA approval in the year 2000, and in that year, 1,000 robotic-assisted cases were done worldwide, and now more than 700,000 are performed worldwide. And this has seen widespread adoption despite mixed clinical outcomes data. So robotic-assisted surgery has changed surgical paradigms and has sparked extensive discourse in such related topics as value-based purchasing, ergonomics, outcomes, and marketing. What I wanted to look at, though, in this study is how robotic-assisted surgery is perceived by both the lay public and healthcare providers. So the methods for this study distributed questionnaires to the public within the form of an academic-affiliated community hospital-based general surgery clinic, and electronic questionnaires were distributed to providers via an institutional email account. And for the sake of this study, providers were defined as physicians, physician assistants, nurse practitioners, and registered nurses. All questionnaires were collected from December of 2019 through May of 2020, and only those questionnaires with 100% completion were included and submitted for statistical analysis. The study participants provided basic demographic data, including age, sex, level of education, and if they had any prior healthcare work experience. Sorry, this slide is a little bit busy, but these were the questions that were included within the questionnaire. And they were asked to strongly agree, agree, slightly disagree, strongly disagree, disagree, or slightly disagree with the following statements. The first was that robots were able to operate independently of a surgeon. The second was that they associated robotic-assisted surgery with improved patient outcomes compared to traditional open or laparoscopic surgery. That they were more likely to go to a hospital that offered robotic-assisted surgery than a hospital that did not, that they would prefer undergoing a robotic-assisted surgical procedure than a conventional open or laparoscopic procedure, and surgeons with robotic training and or those who perform robotic-assisted surgery are more technically skilled than surgeons who do not, that they would feel comfortable undergoing a robotic-assisted surgery at this hospital. And finally, that robots would completely replace surgeons within the next 50 years. The provider questionnaire was similar with just some notable exceptions. They were asked their current healthcare roles and years of experience, and their likelihood for referring a patient to the hospital that offers robotic-assisted surgery in preference to one that does not, and that they would feel comfortable referring a patient to that specific institution. So the results, a total of 278 questionnaires were included in the study with 162 public and 116 providers participating. Of the public respondents, 57.4% were male compared to 42% male providers. And there was some skewing of the data regarding age. 27.8% of the public were aged 45 and younger compared to 66.4% of providers. The educational breakdown was unsurprising. 17.9% of the public had at least a 4-year college degree compared to 78.6% of providers. And of the 116 providers that responded to this questionnaire, 79 were registered nurses, representing about 68% of the respondents. So the first statement within the questionnaire was that they associated robotic surgery with improved patient outcomes compared to traditional open or laparoscopic surgery. So 78% of the public at least slightly agreed with this compared to 90% of providers. The second statement was that they would prefer undergoing a robotic-assisted procedure in lieu of a conventional open or laparoscopic procedure. 69% of the public at least slightly agreed, compared to 84% of providers. The third statement was that they were more likely to go to or to refer patients to a hospital that offered robotic surgery to one that did not. 62% of the public at least slightly agreed, compared to 83% of providers. And the fourth statement, that surgeons with robotic training and or those who perform robotic surgeries regularly are more technically skilled than surgeons who do not. So 64% of the public at least slightly agreed with this, compared to 51% of providers. And the final set of statements, so surgeons are able to operate independently of a surgeon. So 41% of the public at least slightly agreed with the statement, compared to only 9% of providers, and this was statistically significant. And the question that I wanted to look at most was robots will completely replace surgeons within the next 50 years. So 30% of the public at least slightly agreed, compared to only 10% of providers. So the discussion. 64% of public respondents at least slightly agreed that surgeons with robotic surgical training are more technically skilled than those who do not, compared to only 51% of providers. So this first statement differs somewhat from a 2015 USC study in which most respondents did not think that robotic surgeons were better surgeons. So perhaps an additional question to pose would be, would this information make surgical trainees more likely to obtain additional robotic training in order to make themselves more marketable to a prospective employer or to patients? So there was some similarity within the study regarding perceived patient outcomes. In the 2015 study, 72% of respondents associated robotic-assisted surgery with improved outcomes, and here 78% of the public and 80% of providers also agreed with that. The third statement, 62% of public respondents at least slightly agreed that they were more likely to go to a hospital that offered robotic-assisted surgery than to one that did not, compared to 83% of provider respondents. I think this statement is interesting from an administrator point of view as to how much these perceptions actually influence patient decision-making when choosing a prospective institution. The next set of statements was 30% of the public at least slightly agreed with the statement that robots would completely replace surgeons within the next 50 years, compared to only 10% of providers, which was statistically significant. So I wanted to look at the perceived role of robotic-assisted surgery within the next 5 decades. I tried to put this in perspective. So the public is constantly presented with technological advances, including gain of autonomous function like self-driving cars. So I think from the public's perspective, it wasn't hard to extrapolate this to self-operating robots. And obviously, providers have a more nuanced understanding of intraoperative clinical decision-making and skill. And complete robot replacement was less likely from their perspective. And also, I'm sure we didn't want to will ourselves into obsolescence, so hence the only 10% compared to the 30%. And then finally, I wanted to assess some misperceptions of robotic-assisted surgery. So 41% of public respondents agreed that robots had at least some degree of autonomy within the OR, compared to 9% of providers. So I think this, more than anything, represented an opportunity for education, not only to the lay public as to what exactly robotic surgery entails, but also to providers who are referring patients. And I think it would be interesting to compare people's fears and perhaps address and allay fears regarding robotic malfunction intraoperatively. So just some conclusions. There was similarity amongst provider and public perceptions of robotic surgery as they pertain to surgical outcomes, preferred surgical approach, choice of healthcare institutions, and surgical technical ability. The public was more likely to perceive robots as operating independently and as having the capability to replace surgeons than their provider counterparts. And the perceptions espoused in the study highlight a need for both provider and public education, as well as abundant marketing and recruitment opportunities. So the limitations of the study, it was a good sample size of both public and providers. However, the provider cohort was disproportionately young and more highly educated, which could influence the responses. And 68% of provider respondents were registered nurses, this is not a cohort that would typically be responsible for patient referrals and who would also be less likely or be less familiar with robotic surgery than their physician counterparts, particularly surgeons. And that's all I have. Thank you.